Namaste and welcome. In this video, you are going to learn about Shiro Dhara. Shiro Dhara is made up with two words, Shiro and Dhara. Shiro means cirrus, that is head, and Dhara means continuous flow of any liquid medium over the forehead for a specific period of time. So that is the definition of Shiro Dhara. Continuous flow of any liquid medium over the forehead in a pendulum way for a specific period of time. This is called as Shirodhara. Shirodhara therapy is very famous therapy, and you can see Shirodhara photograph where you can see the person is lying down and there is a continuous flow of liquid medium. That liquid medium could be milk, medicated buttermilk, medicated oil, or medicated water. So you can choose any liquid medium as per condition, as per imbalance of the patient. So this topic, this Shirodhara, I'm going to discuss in this particular topic in this video. After this video, you will see the procedure, the demonstration, how actually practically we are doing Shirodhara. You can check out the next video after finishing this one, because in this video, I'm going to tell you in what condition Shirodhara is beneficial and in what condition you should not do Shirodhara and what precautions you have to take it. And what precautions you have to take in Shirodhara. See, it's a traditional Ayurvedic therapy. It's a continuous pouring of warm medicated oil, buttermilk, milk or decoction over the forehead. Clear? Why we have to do? What's its purpose? It's calm down the nervous system, it balances doshas and promote mental relaxation. See, there is some conditions where Shirodhara is really very beneficial, like neurological and psychological disorders. We know there is so much stress and anxiety nowadays, and Shirodhara is very effective for that. For depression, for sleep disorders, insomnia, chronic headaches, migraines and mental fatigue. Shirodhara is very helpful in nervous system disorders also, like Parkinson's disease, cervical spondylosis, paralysis and hemiplegia. Shirodhara is great for our hair also, for premature graying of hairs, hair fall, alopecia, psoriasis and stress related eczema. Shirodhara is great for hypertension, hormonal imbalance, especially in the menopause condition or in pre-menopause condition, post-menopause condition, when there is so much imbalance in the hormones. This therapy really works like magic. And memory and concentration issue. See, according to my experience, because frequently on almost every day we perform Shirodhara for our patients, I feel this is this is the therapy in which person can go for a meditation state. It's very difficult for a person who is undergoing through the anxiety, depression or any stress related issues to tell them or to force them, okay, go and do meditation. This is something very impractical for them. So for helping those people, Shirodhara really helps, because when you are lying down, you don't have to do anything. You just lie down and the pendulum way of the liquid which flows over the forehead, it do its work. It just stimulate your Ajna Chakra, here pituitary gland back here, hypothalamus gland back here, that really start releasing hormones like serotonin, dopamine, and they start relaxing person, and person goes to, researchers says, person goes to alpha wave. Alpha wave is the meditative state. It's a deep meditation state. And for some moments, for some minutes, the person goes to a deep sleep. When they start going for the deep sleep, they start getting relaxing. The good hormones start getting released inside the blood, and that's what stimulate healing. Here where the healing starts. That's how Shirodhara really helps in many issues. But there are conditions where Shirodhara should not be done. Like if somebody is suffering with the severe infections, fever, acute sinusitis or cold, like person is sneezing, running nose, running eyes, in that condition, Shirodhara should not be done. Head injuries or there is open wounds over the scalp, epilepsy, uncontrolled convulsions, Shirodhara should not be done. Severe weakness, fatigue, pregnancy, especially first and third trimester, and uncontrolled diabetes and in uncontrolled hypertension, Shirodhara is not advised. We have to put them first we have to take them into the control. There should not be very high blood pressure. Okay, in that condition, Shirodhara should be advised. Shirodhara should not be advised. So these are the contraindications of Shirodhara. Types of Shirodhara. See, when you do Shirodhara with a medicated oil, that called oil Shirodhara, in Sanskrit Taila Dhara. So Taila has to be used. The oil has to be used according to body constitution of person, according to imbalance of the person, or what problem he's facing in his life. According to that, a doctor, a Vaidya, has to choose the right oil. Common chosen oil is the Ksheera tel, Brahmi tel, Chandanadi tel, Maharannarayan tel, because these oil has efficiency to calm down Vata, Pitta, Kapha, and what imbalance is there in persons. According to that, we have to choose the oil. Okay? Yes, you can do the Shirodhara with medicated milk. That's called Ksheera Dhara. And we have to medicate the kshir with some herbs like bala and ashwagandha. Mostly as milk is pitta balancing, vata balancing. So we choose all those disease which is more problematic, which is arise due to the imbalance of vata and pitta. There, the Ksheera Dhara is advised. And in summers also, we choose milk, kshir, we choose milk Shirodhara instead of oil Shirodhara, because of its very oil is very warming. It creates hot sensation. The milk gives cooling sensation. So the skin related issues, burning sensations, hormonal issues, we usually choose Ksheerdhara. Buttermilk Shirodhara, that is called in Sanskrit Takra Dhara. So medicated buttermilk infused with the amlaki, that is gooseberry, or some other herbs according to conditions, so great for a psoriasis and dandruff and stress. One more Shirodhara, that is called herbal decoction Shirodhara. In Sanskrit, it's called Vata Dhara. Herbal decoction with the Dashmula or Trifla or the Brahmi. It's more indicated for Kapha and Vata related problem. Okay, usually we don't do Shirodhara in sinusitis, but sometime if there is so much vata related very chronic sinusitis, then the warm buttermilk we use for the Shirodhara. It always totally depend on the conditions of the patient. Then water Shirodhara or Jala Shirodhara. The cool medicated water, sometimes mixed with the rose water or the sandalwood, so best for the pitta imbalance and high fever. Yes, in fever we should not do Shirodhara, but in extreme conditions, if the fever is not going, some acharya says you can put, usually what we do the cold padding over the forehead in the very high fever. So if there is a situation allow, you can put the water also over that, so that cool downs the fever. So that logic is there in this Jala Shirodhara. Otherwise, if person is really suffering with the long fever, the Shirodhara is not advised, especially the oil dhara. So in conclusion, Shirodhara is effective therapy for mental, neurological and skin condition. Proper assessment of indication and contraindication is necessary, and selection of the appropriate liquid according to therapeutic effect. This is very important to select with the right, because I have seen choosing the wrong medium for Shirodhara, choosing the wrong time, the Shirodhara with the wrong diagnosis really create many problems, many issues to the patient. Because instance recently there was a patient, she was having so much heaviness over the head. She didn't mention it in the history. I was asking her again and again. But when we did the Shirodhara, after that problem really increased. Then she told, I was having so much heaviness. See, because if the heaviness is there in the head, we have to choose the right medium. Takra Dhara is the best, but we do the oil dhara, that problem increase. So the right diagnosis, right oil, right time, even though they are really important. And the best time, the effective time for Shirodhara is 1 hour. And you can go for the Shirodhara for the 3 days, for the 7 days, or the 14 days. So according to condition, they are also advised. Shirodhara can be done after the Abhyangam, the full body massage and steam, and then the Shirodhara that can be performed in combination. Lonely Shirodhara can be as a single therapy also it can be performed. So this was about the Shirodhara. In next video you are going to see the whole demonstration of the Shirodhara procedure. Go and check out, you will enjoy and learn so much. Thank you so much.